limitations right now, but saying like, look, I have this amazing tool, but right now often in hospitals AI is being used but not even disclosed to patients, and that's, I think, a problem we need to address. And so education is also one of the big things. And then of course from a research perspective, we need to do more research, developing best practice guidelines, but also probably need some regulatory changes, you know, getting some standards, regulatory standards that help to give everyone like a set of standards at least, and some security and transparency.
Terrific suggestions. Lene, thoughts?
Yeah, I definitely echo what everybody has said so far. And I guess I would go back to, you know, thinking about bridging together all of these different fields and backgrounds, bringing together multidisciplinary teams from diverse social, cultural, economic, academic, industrial, technological, all of those different backgrounds together, having them, you know, all share a seat at the table, an equitable seat at the table to discuss, you know, the pathway forward here. I think that there's just so much value in bringing all of those groups together.
Right. Thank you. So I see LeBone. Do you have any perspective?
Yes. One practical thing that I think, you know, every organization on here can do is begin that intentional partnership. You know, when I look at the list of incredible organizations that have been involved in this conference, MIT, University of Chicago, NYU, IBM, Stanford, CVS Health, Mayo Clinic. I mean, the list goes on. Each one of these organizations has funding dollars now that they utilize in particular ways. And each one of these organizations has initiatives that are tied to work that relies on community, on information on the ground in the community that's already being gathered by community-based organizations. And so one major step that can be taken is for these organizations to begin to build a relationship with a community-based organization today that they can partner with. Yeah. The partnerships have to start somewhere. And what I see on this conference is a marketplace of organizations that can begin to partner because they're doing the same work.
Fabulous. Now I want to ask if any others, I'm not all the videos are on, but any other perspectives or Ngozi, if you have other ideas that you want to make sure we hear.
Yes, I would like to share a specific recommendation that in Brooklyn we have been using, and in New York State. BPN has been engaged in collaborative work for 99% of our programming over the 33 years of our existence. So we have quite a lot of experience. We've seen about everything that could happen in partnerships between clinical and community, business and community, and things like that. And one of the things that we find is particularly needed is that if communities are being engaged, if and when communities are being engaged to come to the table to participate, there must be a commitment to value their intelligence. Because often we're at the table and it's we may or we may not be listened to. But the intelligence that we bring to the table cannot be gotten any other where, because we're on the ground, we're in the trenches, we're in the homes of these clients. We see what the client and observe what the client don't tell us and what they wouldn't tell anyone. Because when they go to the doctor and they ask the question, they answer in a way they think would keep them safe and would make that the doctors need to know without getting into their business. But when we're in the community, we see these things, and the people, the relationships that are developed are trusted because they want the services that we have. And so we in the community become the mouthpiece. So we can often select among these clients those who are willing to be advocates and who are willing to engage on behalf of their group. But they need to be developed. They need to be trained to do public speaking and not be afraid to open their mouth to say what they think because they feel devalued, while I'm only a housewife, or I'm only a teacher, or I'm only this. And when I get to the table with these scientific, it used to happen to me until I had to retrain my head that I have enough intelligence as the researchers there, because what I have, they don't have. Yeah. And investing in community-based organizations to develop participatory approaches where you actually develop people who can then speak on behalf of the people of their kind, because one person can't speak for everyone. Our communities in New York are multi-ethnic and diverse. And so that investment in people and relationships, which AI cannot do, is important. And one of the things that we have been doing is encouraging community advisory groups on board for projects. So when a project comes into the community, you have these people who are the gatekeepers or informers of the community that the community people trust, usually the community-based organization who've been serving them, or community advocates that are speakers on behalf of the people, and they're well known. It could be retired, resigned elected officials, but with whom the people still engage. These people can be consulted and say, could you help us to identify those trust brokers in the community who can help us identify, inform, and train? And it was mentioned here that on the call by others that you must break down the technology. The digital divide will get worse if the movement continues on behalf of the profit makers where it's going, and it would increase the distrust about anything that comes with a technology background. And we can see with the COVID and the vaccination and the whole distrust about science that there's no small joke about that distrust. So engaging community in ways, in collective forums that the community can recognize and trust and know that it represents them, and funding those adequately. So people are not coming to participate and don't know how to babysit, who's going to babysit their kids when they leave. Yeah. And we have trained community health advocates who volunteer to be trained, who then go back into the community and do a wonderful job because they take pride in knowing I am working for, on behalf, and with the community in which I grew up and in which I live. And what it takes is to pay them for their time when they come to the meetings, pay and train them with certain development skills. And then, you know what, they go on their own to achieve other things because they suddenly see a ladder in life that make them valuable, more valuable than they've been before. So
you have offered an excellent playbook for how to move. And Lene was talking about this. We have to start, not just listen, but be where people are and grow together in this relationship. So thank you all. I just want to make sure if there are any other presenters or reactors who wanted to share their recommendations for path forward, that we make sure to include that. Suzanne?
Yes, I just wanted to mention on both the health system side, a lot of what we see in terms of new models and their deployment, it's usually large, well-resourced health systems, and if we want to think about AI maybe moving a needle in health disparities, we really have to make sure that places like our federally qualified health centers have access to good EMRs, good data and compute infrastructure. And actually these data points can somewhat help model building as well, because they help grow our numbers around underrepresented minority groups. So, before we move too far along, we also have to make sure everyone can deploy and use these in practice.
Thank you. Terrific. So now I'd like to turn to my co-chairs for their reflections and ideas that they have from today's session about path forward. So, John? I don't know if he was able to stay. Reed, are you still on?
With great enthusiasm.
Oh, there we go. All right, so there he is. There he is. I didn't give him enough time. So hold on, Reed. So John, and good, we have all three here, which is wonderful. Sandra had to leave, but John.
First, Barry, let me thank you and all of the presenters for a terrific session and great amount to reflect on. I'm going to be very brief as I try to integrate the entirety of the day. We heard a lot about what needs to happen to address bias and really propel equity in healthcare through the use of AI/ML. And we heard more recently about the interface with community as a mechanism to ensure that. So I come as a summary comment to how do you make that happen? And, you could actually create a government regulation that says there are a set of standards, but a government process is not going to be agile enough to make sure that that occurs. And so I throw out a challenge. I wonder if we don't need a public-private entity that reviews applications or submissions on the proposed use and can, with agility, turn around the decision, does this comport with whatever the national ethical framework of standards are, as well as demonstrate engagement with community and even perhaps address how the community receives support in kind for engagement in that activity. So that's one thing that it brings to mind for me in terms of concrete action steps to really integrate the technology with the social construct. Thanks.
And throughout today, partnerships have been the key recommendation through many, many presentations. Reed?
I, like everyone on this call, have drank the Kool-Aid and am excited and energetic and enthusiastic about the promise and so forth and so on. That being said, today has left me not only impressed by the speakers, but left me greatly concerned. I am very much more anxious than I was before I started today. And that's not a bad thing. I mean, again, we're people who like to solve problems. We're not people that are intimidated by problems. So I still am drinking the Kool-Aid, but I will say that and the reason that I'm particularly focused on right now is because of the COVID work that I'm doing. I mean, everything I do 7 days a week is involved in the Black community trying to get through on COVID vaccination. I am getting everything that I thought I understood in terms of the depth of the mistrust, misunderstanding, lack of scientific preparation for complex concepts like an mRNA vaccine, about herd immunity, by nuances of risk-benefit ratio calculations, everything that I thought I knew about how tough that was over my entire career. Has been, it's worse than I ever thought it could be today. And so the notion that we are going to turn over potentially such an incredible amount of healthcare decision-making to a process that is definitely not ready for prime time, but also is not understandable to the average person and certainly to communities of color, where we do not have trusted messengers who can or are trained to know how to carry the message, who do not have a track record of relationship with the community about these matters, where personal, deeply personal information being shared with people in complex systems that they don't understand. Without going through it anymore, what I'm saying is that this is going to require an awful lot of tilling of the soil. And that tilling of the soil is not just sound bites, it's not just the message, it's who will be prepared to make the messenger and how will that all work. So now I realize that, and I'll just conclude with the other big thing that we're trying to do nationally with the National Academy of Medicine and others is how do we mount a literacy, a campaign for the Black community to embrace science. This is fundamental. How did they create a vaccine that fast? Something must be terribly wrong, as opposed to celebrating the human genius, that the fact we were able to, worldwide collection of scientists were able to do something remarkable. So how do we get at this macro issue? And now I realize I'm gonna have to add this to that portfolio. Sorry to go on so long, but I just cannot overemphasize to you how difficult this is going to be.
Yes. Thank you, Reed. So now, Bill, how do you build on that?
How do you build on Reed Tuckson? It's
How do you build
impossible.
on Reed Tuckson? Yeah, right.
I found today fascinating, but the message I take away, as John did and as Reed did, is we have work to do. These were fascinating, important presentations and discussions today. But what I take away is the social challenges of this science are just enormous. And Mary, this is really important input for our culture, inclusion, and equity collaborative. The theme is we need everybody at the table. And I think, as John said, we need more structure. And we saw today that, that AI and ML are powerful tools, but we need to see them as a means to an end. And that end is social and health equity, access to better care for all, and a healthier nation. And that's where we need to go.
Well, I'm not going to build on any of your comments. They speak for themselves. This has been it's sped by. A session that started at 12, it is now close to 4 o'clock. And the care with which all of our presenters, our reactors, the deliberate and intentional investment that you made to make sure that all of us here today, and especially all of the attendees, really walk away with a rich understanding of an exceedingly multifaceted, very complex issue that really does require all that you described: standards, ethical frameworks, real political will, the governance structure to make that happen, the investment that needs to happen, with all of the challenges grounded in a nation right now and communities right now that do not trust us, is something that should, on the one hand, as Reed said, make us very, very concerned and anxious. On the other hand, turn that anxiety, convert it to real action, because absent that, we are going to, as all of you described, widen what is an inexplicable gap in the care that people are counting on. So, and that's not just healthcare, that's social care, that's the support that whole people need, families need to live and thrive. So we are committed to, with your support, to really take action through our respective collaboratives and with your continued input, because this really is, as you all said, all of us have to be at the table. This is not any one, all of us and many, many others, as you've described, are stakeholders in this journey. So we welcome your continued input, your ideas that you would bring to the National Academy of Medicine, to the Leadership Consortium, to our respective collaboratives. I want to end with, on behalf of Michael McGinnis, a great big thank you for bringing to us your gifts, your perspectives, your honest, open. It was really a robust, rich conversation with lots of different ways of thinking about the world, and that's what we need. I also want to end by thanking an extraordinary staff. I mean, this is, the co-chairs here get to sit and be, on the Brady Bunch view, but it is the backdrop. And I'm going to really make sure that I read these names, because we have a team they are our gifts. So Ayadola Anise, who is Deputy Director, Laura Adams, who is Special Advisor to the National Academy in this effort, Elaine Fontaine, Special Advisor, Noor Ahmed, Associate Program Officer, Asia Williams, Research Associate, Ariana Bailey, Senior Program Assistant, and Ariana, best of luck to you in your next adventure, and Allison Lester, Senior Program Associate. They're the ones that brought you all together. They're the ones that planned this entire event. They're the ones that made magic happen at the National Academy of Medicine, and we are unbelievably grateful to them and to all of you our participants, our reactors, our attendees. Carpe diem, we have a lot of work to do. Thank you all very, very much. Take care.
Thank you so much.
It was very well informing. Yes.
Thank you.
Thank you, Amy Lebon.
Job, everyone.